Today we're here to talk to you about remote nursing and all the different pathways you can get into remote nursing. I'm Brittany.
I'm Hayley.
I'm Sarah.
I'm Sarah Jane.
So, what is remote nursing? Remote nurses work in a broad range of areas throughout Australia. They can range from remote Indigenous, mining, pastoral care, industrial, fishing, tourism, railway, agriculture, island, detention, refugee, and international community development.
Healthcare spans across acute, urgent, chronic, preventive, public, and emergency care within a primary healthcare framework. Remote nurses work in small teams while experiencing personal and professional isolation.
They often care for people of extreme health needs, providing care across the lifespan to people in the context of family and communities.
These areas are very isolated and in high demand for healthcare workers. Remote nursing is a unique field to be a part of. It isn't your average clinical setting and the conditions are extremely different and demanding. So now I'll pass you on to Britt, who will talk about grad programs in the Northern Territory.
So the Northern Territory Government offers a graduate program specific to remote nursing. This graduate program is offered across 3 different hospitals. It's the Alice Springs Hospital, the Katherine District Hospital, and the Royal Darwin Hospital. This graduate program is only offered on a part-time 12-month basis of a 32-hour week. Rotations include ICU, theatre, special care nursery, renal, mental health, aged and community. Yeah, so now I'm going to talk about, Hayley's going to talk to you about how to apply for this graduate program.
Okay, so you can apply via the Northern Territory Government Employment Opportunities website. It has the online recruitment application on there. But you can't send your application via post. That's just one rule, so keep that in mind. You've got it?
Yeah.
So there's a link there, and it will take you straight to the page where it just explains it step by step as to how to apply. So Sarah and Sarah are going to talk to you about another graduate option. Okay, so we're going to talk about the Kimberley Graduate Nurse Program in WA. This program consists of at least 16 weeks in each of the 3 major hospitals in the region, Broome, Derby and Kununurra. Broome or Derby rotation may give you the opportunity to spend 6 weeks in the emergency department setting and also give you the chance to work in mental health if you choose to do so. The final 4 weeks of your 12-month contract will be spent in the small hospitals like Fitzroy Crossing or Halls Creek. All 3 hospitals support surrounding small hospitals and remote areas, including servicing a large Indigenous population. Broad medical and surgical experience will be gained throughout this contract, incorporating working with adult and paediatric patients. This program suits graduates interested in remote areas, Indigenous health and mental health. Sarah's going to talk to you about how to apply and the intakes.
So, the intakes are in February and they only take a total of 7 people. The rotations are between the Broome Derby and Kununurra Hospital. The contract is full-time grad program, so your employment status is a 12-month contract. In relation to applying, you go through the Government of Western Australia website. You'll find a link for your Grad Connect, so they use Grad Connect to do this. And this is where you register. So the Grad Connect applications open on the 30th of June and they close on the 14th of July. So these are the postgraduate diplomas in remote nursing.
So I'm going to talk to you about a postgraduate diploma in remote health. This postgraduate diploma is designed for health professionals that have had experience in the remote field and who want to advance their knowledge and their critical thinking skills in relation to remote nursing. The course is offered at Flinders University. It's a duration of 1 year. To enter the postgrad course, you have to have at least a Bachelor of Nursing and a minimum of 2 years experience in remote nursing. Or you can have your grad certificate
only cost you $4,832, which isn't too bad. Applications close for semester 1, so they close on the 17th of February. If you want to go in semester 2, they'll close on the 14th of July, and semester 3 closes on the 14th of November. If you are in extra need of help with money-wise, they've got HEX help and they've also got fee help. Extra help can also be found through scholarships and financial assistance. It's for 1 year part-time or 2 years part-time maximum, so it's up to you how you want to do it. And if you'd like to find out more information, there's a number just there. Now I'll give you to Hayley.
Okie dokie. So if you're not successful at getting a graduate year, we all know we're worried about that. So there's other avenues you can take. So there is a graduate certificate in remote health practice, and that's at Flinders University as well. It's an 18-unit program, and it's only available on a part-time basis though. It's a duration of 6 months, and the 18 units cover streams such as allied health, individual practice, medical nursing, remote child protection, and remote pharmacy. Now, you must have your Bachelor of Nursing for this, which you hopefully will all get. Now, the cost, if you go through like the HEX version, it's $4,304, and full payment is $9,000, which is a little high, but I'm sure it will be worth it. You can apply mid-year, and it's also through SATAC. So that's kind of, I think it's like VTAC, so when you apply through like year 12.
Yep.
So now I'll pass you on to the other Sarah, who will explain to you another option.
Okay, so that's one option you guys can do if you don't get a grade year, or you can take it upon yourselves and do a short course. Now, the short course is really just for people who want to get a feel of remote nursing, what it's going to be like, what they're going to be in for before they really do make the decision, instead of spending, $9,000. This is the cheaper way to do it, and you still get your education. Okay, so this short course is held by Flinders University and Charles Darwin University. It is the transition into remote area nursing. Here are some of the things you will do in this program. Framing Indigenous health, so learning about the different cultural differences that you will find. Self-care, discussing the different aspects of adapting to living in remote areas. They will go through what you would expect to deal with, how to deal with it, and your living conditions and how to, the move, the change. Remote advanced nursing practice, this will be going through the advanced skills you will need to know in remote nursing, for example, assessments and clinical reasoning. Then you'll also do a pharmacology for remote area nurses. This part of the course will go through drug therapies and guidelines in the remote setting. You'll do a course on remote emergency care, and the commencement for this course is on the 23rd of June through to the 11th of July. So yes, it is quite short. It is located in Alice Springs, and it's $2,800. So to apply for this, there is a direct application online on the website. You fill that out, send it off, and go from there. The next part that we will all be talking about is different areas that you can specialise in remote nursing. Just briefly, going to talk about those few things. So, Britt?
So nursing in the mines, it's a great way to broaden your knowledge and your experience in a remote nursing in a very specialised way. And it is a very great way to start a savings account. To apply, you need at least 12 months experience in the emergency department. You need to have your IV cannulation competencies. You need to have experience in triage and completed the remote area nursing course via CRANA, and also a MINS course. The pay for this, for entry nurses for year 1, is $58,200. For a senior nurse, it is $108,360. And the average wage is $80,120.
I'm going to talk about remote school nursing. Unfortunately, we just had school nursing spoken about. So, the remote strong interpersonal skills. Earnings. So I found two separate earnings which are very different. So in Australia I found 43,856 one, but outside of Australia in remote areas I found an $86,000 one. So there's a bit of confusion there again. Education-wise, there are schools that employ licensed practical nurses, but the National Association of School Nurses highly recommends a 4-year bachelor degree and a registered nurse's certificate at minimum. Training, they want you to have finished your graduate year and then go on and at least have 2 years of acute nursing under your belt. What's next with this pathway? You can move on to greater things like coordinating health programs at district or even state level.
Okay, so I'll be talking about if you guys are interested in specialising working with Indigenous people. So as mentioned before, the WA Kimberley Graduate Nurse Program also has an extensive part in Indigenous health. Indigenous people take up 30% of patients seen in the Kimberley area. The Kimberley Grad Program also has connections into the Aboriginal communities where you'll be able to expand on your knowledge working with Indigenous people. If you're interested in learning and expanding your knowledge about working with Indigenous people in the healthcare setting, the Kimberley Graduate Program is the place for you. So once you do your grad program, you can get a choice, you've got that under your belt. If you really were interested in working in any of these things, that's the way to go.
Okay, who wants to be a nurse in the Royal Flying Doctors?
No one.
Alright. Yeah, it is. The Royal Flying Doctor Service is one of the largest aeromedical organisations in the world. It delivers primary health care and 24-hour emergency service to those who live, work and travel throughout remote Australia. Today, the RFDS has 63 aircrafts operating from 21 bases throughout Australia. It provides medical assistance to over 290,000 people per year. That's 1 every 2 minutes. That's impressive. So the selection criteria, you'll need your registration in nursing. They prefer you to have emergency nursing or critical care experience or your certificate in critical care. Postgraduate nursing experience is also good. And have their Australian citizenship, which we all have in place, so that's okay. Current vacancies are advertised on their website. They can be in newspapers as well, but it's mainly on their website. And if the job you want isn't currently advertised, you can, there's a link there that you can go onto and you can actually apply for the job that's not there, and they'll put you on a waiting list and they'll contact you when that job comes up. So applying for a job, it's a 6-step process. So you apply, you register on the internet and submit your resume. You have interviews. So you'll be invited to an interview, and then if you're successful, they'll call you by phone, as always by voice, and then you'll receive a letter in the mail. They decide, and then the 4th step is, if you're successful, that's what I just said, okay, orientation, and then the probationary and qualifying period. So as like a normal job, you'll have a probationary period of 3 months, and if everything went okay, then you're fully employed and ready to go. And now, Britt.
Now we're going to talk about a 5-year plan into remote nursing. This 5-year plan involves a graduate year. So first you'll finish your Bachelor of Nursing, which you're nearly all done, and then you would apply for a graduate year. You can apply for the Northern Territory one we mentioned, or the Western Australia one, or you can find your own one and apply. Most applications via CETAC. And then next you would complete your postgraduate in a remote field. They usually take 1 to 2 years roughly. And then you can specialise if you want after you have experience. So to specialise, all of these is required to have experience in between them. And you don't even have to do a graduate year or any of these certificates mainly. You could apply in a hospital straight out and get into remote nursing. But this is a great way to broaden your skills and your experience.
Okay, so what you can do if you do not get a graduate year, so
to really know if that's what you want to do and that's how you want to follow it. Those certificates give you another step. So the hospitals recognise those certificates as you're really interested, you know your topic, and then from there give you a job. So you don't need experience, but if you do go on and do your study, that's going to get you in at the end of the day as well. And then also from then there's your specialties that I mentioned before.
References, if you guys are interested. Any questions? You ask a question, you get a koala.
Anyone? Come on, they're pretty cute. And they clip onto things. And one of them,
Do they have flying midwives? Is midwifery another aspect that will help you get the job?
Yes, it will. Because really there's only 1 or 2 nurses on each plane. So, good to have your midwifery skills. So, good one. You get a koala.
Yep.
Just with the Royal Flying, is there a doctor on every plane as well as the nurses, like a couple of doctors, or?
Yes, there is. Good question. Pretty sure there's 1 doctor. Yeah.
Some of the clinics might just have nurses, so what they call a RAN, nurse, remote area nurse. So some of the clinics, the doctor just comes in, but then it's most of the clinics.
Yeah.
Keep asking questions, guys.
Don't ask too many because I want to go.
Oh, we have 2 girls.
And guys, just with these calendars as well, if you were interested, we've actually put in the dates of when all the courses commence, when they're opening, applications open and close, and all that sort of thing. So that's all in there